Uh, the government's new coronavirus guidelines, which allow close family members to visit dying relatives, Nick mentioned them just there, well, they will be welcomed by many. But sadly, they came too late for those who've already lost loved ones to the virus and found themselves unable to say goodbye in person. Alex Yuen died in hospital at the age of 71 after contracting COVID-19. His family found a way to connect with him during his last days via video calls. We're joined now by Alex's son, Sebastian Yuen, who's a consultant paediatrician himself. Sebastian, thank you so much for joining us. As you and your family are, I imagine, still getting to grips with the loss of your father. Tell us a little bit about the man.
Thank you very much for inviting me on today. Alex was a big character. He was very passionate. He was always campaigning, and he ran a Chinese clinic in South London. And he worked so hard to help patients who came to him with chronic diseases or sometimes with medically unexplained symptoms. And his method was to listen to them and respect them and ask them to switch off their devices at 7 o'clock in order to get restorative sleep. And he said the body heals itself. He was a very big believer in human rights and respecting patients. And that's why it was so difficult for us when he became unwell at the beginning of March. And to see this larger-than-life character who was always the center of attention, the loudest in the room, full of positivity, to see him lying down, weak, unable to move, and yet he refused to go to hospital. He said, people who go to hospital die. He said, I don't want to die alone. And he, even though his body was increasingly weak, he knew his mind, he was clear, and we had to respect him. And that was really difficult because we just thought if you go into hospital, you get some fluids, you get some oxygen, that will help you. And that will help you recover. And he stayed at home for days and days, and he eventually collapsed. And it was actually 3 weeks ago today. It was the first clap for our carers. And I remember being out in the street in Sheffield, and it was such an emotional moment. We're all connected with the neighbours. And 2 hours later, my father finally collapsed at home and agreed to allow an ambulance to take him to hospital.
Tell us
I remember Louise and...
Sorry, Alex. Sorry, Sebastian. I'm so sorry to interrupt. So tell us then what happened next. He had collapsed, and at that clap for carers, having been reticent about going into hospital, and then ultimately the hand was forced. From that point onwards, what was your view, his view, of the treatment and the eventual outcomes?
We were filled with some hope. We were given great compassionate care at St. George's Hospital. They spent a lot of time talking with us and explaining things. They were patient, and we can't fault that at all. We were so delighted. They really took the time, and I know that they're so busy. And he didn't like the face mask. He said it was putting pressure on his face. It was really loud, all the oxygen. He needed maximum oxygen. And he kept complaining. He said he couldn't be comfortable. He said, this is inhumane. I don't want to go on like this. I have human rights. I have the right to choose whether I live or die. I have the right to choose whether to go home or stay. And this was so difficult to listen to, and we had to respect it. And so we chose to make a family video call to discuss this, to discuss his potential end of life. And on that call, a WhatsApp video call, was his wife, Melina, and my two sisters, Chingy and Alicia. And I led it and really listened to him and started where he was at, trying to understand what he wanted. Because even though I felt if he stayed there, he would have a good chance of living and get home and be strong again. And he said he wanted to go home. And I said, you have to be 100% sure. You can't be 92%, 88% sure. You need to be 100% sure. And he hesitated. And actually, he decided at that moment he wasn't 100% ready. And so I said, "What would you like to do in the next day or two?" And he thought for a moment. And he said what he would like to do is complete his book. He's compiling a book of testimonials from his Chinese clinic, and he has helped so many patients, and they have written such positive feedback. And he wanted to put that together as a service to spread the word about what is possible.
Sebastian,
And I suggested to him.
I wonder if you can tell us, because I don't want us to run out of time, but one of the key things in all of this, having heard from the Health Secretary yesterday about them attempting to make it easier for loved ones like yourself to see their families at the end of their life, how important to you was that call?
Quickly then. So the first, at the end of that phone call, I suggested that he could use the power of his mind to overcome the inconvenience, the pain, and that would make an epic final chapter for his book. And that really inspired him. And in that moment, we were so close and so connected and so real. So it was probably the closest we had ever been. And he said he loved me, and I said I loved him, and we meant it, and we were really together. And so the first message is actually you can be totally present and totally together, and it is so powerful through a video call. You don't have to be physically in the same room. So that was the first thing. So I think everybody should be allowed this possibility of video calls, boosting Wi-Fi, giving devices, and supporting it. Because one of the problems we had is when we tried to make a call the next day, which was his final day, he slept most of the day. And then when he woke up, he didn't know his PIN number and couldn't unlock his phone. So the nurses had to call us twice. And then when we finally got there was 8% left on his phone. So there's that. We were very fortunate because after the final video call with Singapore, which was again very powerful, and he actually said, "I'm 100% ready to go home now." That really meant so much because that brought a lot of closure. He was ready. So that, even though I wasn't present myself at the end, that brought a lot of closure for me. He died 2 hours later. I just want to emphasize that actually, because the family had been in the building for that final video call, the nurses kindly let his wife and my 2 sisters into the room for those final few seconds. And actually being present together for those final seconds meant everything to them. And I'm so grateful that Matt Hancock has actually said that families should and can be allowed to be together at those final moments. But video calls and harnessing that technology, which is very, very simple, and boosting Wi-Fi to enable a strong signal, there are a number of simple things that we can all do.
Well, Sebastian, our condolences to you on the loss of a man who sounds quite incredible, frankly. Very, very briefly, because we are just about to run out of time, if you had a message for the staff at George's, a hospital I know well, they very ably treated my very young, very ill son not that long ago. If you had a message for the members of staff at George's who looked after your father, what would it be?
I really want to clap for our carers all across the country, both at St George's and in care homes across the NHS. I'm so grateful. Your compassion meant so much to us at such a terribly difficult time. So thank you very much.
And I know
my father is very proud.
Sebastian Yuen, we just lost you at the end there, but I think we got everything we needed. Thank you so much. And again, our condolences on the loss of your father.
Thank you very much.